Greetings, everyone. This is Eric Hong, Executive Director of the Momiji Healthcare Society, posting a message to the seniors, residents, tenants, and their families. Today is February 9, 2020. The Lunar New Year is only 3 days away. It is a time that is important to many people of Asian descent when families visit with each other to celebrate the beginning of a new year. However, at the risk of being a killjoy, I must appeal to everyone to be mindful of the pandemic times that we are in at the moment. The Government of Ontario is nearing completion of Stage 1 of its plan to vaccinate essential healthcare workers as well as the most frail and vulnerable seniors residing in long-term care homes and retirement homes. Ontario has essentially been in a state of emergency lockdown for almost 3 months now. We are all feeling the impact of the many restrictions on social and commercial activities. But perhaps, on account of both of these measures, we have seen the spread of COVID apparently beginning to show some sign of slowing down over the last few weeks. Fewer new cases are being detected each day. But among those identified, there has been a steady increase in appearance of the more contagious version of the UK variant of the COVID virus that has caused tremendous harm and damage in the United Kingdom and other parts of the world. We cannot yet let our guards down. Closer to home, I regret to have to report that we have now encountered the first case of COVID-19 infection among tenants of Momiji Seniors residents just this past weekend. The individual affected is now in quarantine. We are aware that a care provider privately retained by that tenant has also tested positive. This care provider has not been entering Momiji since her COVID positive test result was learned. Momiji staff have since been conducting contact tracing and informing everyone who may have had interaction with the tenant and/or her care provider, and advising them to get tested to determine if anybody else may have been inadvertently infected. So far, everybody that has been tested has returned a negative report, meaning that nobody else has been infected. To respect the privacy of the individuals involved, we will not be disclosing the identity of that tenant or the care provider. Please rest assured, however, that our support services staff are in consultation with Toronto Public Health and taking every infection prevention and control precaution to ensure that no other tenant or staff is put at risk of infection. This brings me to a related worrisome subject. Despite our repeated pleas for cooperation, there has been quite a number of tenants who have been receiving social visits from multiple visitors. Over the holiday period and into January, there have been almost 30 tenant households who have had at least 2, and in some cases up to 8 family members and/or friends visiting them at Momiji. This practice must not continue. We have reminded everyone many times that in accordance with the directive of the Ontario government and Toronto Public Health, each household should only interact socially with at most one other family member or friend who does not live with them. It is imperative that where many frail older persons congregate, such as at Momiji Seniors residence, that the number of other people entering into this living space be kept to an absolute minimum, so as to keep the risk of infection spread as low as possible. The fact that we have now had one COVID positive case found among us attests to the need for all of us to comply with the one visitor rule and keep each other safe. Momiji staff is doing our part. In order to provide support and care to our tenants, there has to be a minimum number of essential staff on hand to deliver services. We have arranged for as many colleagues as possible to work remotely from home where the duties and functions allow. Only those who absolutely needs to be on site in person are coming into Momiji. We need and ask for the cooperation of our tenants and their families to help by keeping to having only no more than one designated visitor to visit with each tenant apartment and not enter into Momiji premises if at all possible. As soon as public health advises and the government specifically lifts the restriction on social visits and activities, we will reopen more on-site programs and services and inform you accordingly. I have already mentioned earlier that stage 1 of the government-implemented vaccination program is nearing completion. We fully anticipate that supportive housing settings like Momiji Seniors Residence, where there are concentrations of older adults, will be next in line to be inoculated. As you know, we have been speaking with you to ensure that everyone who wishes to be vaccinated is included in a list ready to be presented to the vaccination clinic when one is set up for our local area. In closing, I'd like to say that, especially in light of the fact that we have now encountered the first COVID case at Momiji, it is even more critical that everyone be mindful of the various infection prevention and control measures in place, including masking when in public spaces, practicing diligent hand washing, maintaining physical distancing, and minimizing social contacts. As a reminder, let me be clear and reiterate. The one visitor per tenant rule at Momiji means only one specific person from among a tenant's family and relatives is to be the designated and only visitor to each tenant at Momiji Seniors Residence. It does not mean that various family members can rotate among themselves and take turn visiting one at a time. If in doubt as to whether someone should visit or not, please consult with Momiji staff for clarification and confirmation before visiting. It is by everybody cooperating that we have been able to keep the virus from spreading into Momiji throughout 2020. Until this wave 2 of the COVID-19 infection spread is brought under control, please work with us by designating only one specific individual in the family to visit your loved one who resides at Momiji Seniors Residence. Thank you.